Hi everyone, Healthhannex TV, an online natural health platform where we look at the failed-proof concepts and guidelines of natural health to recover and maintain health, especially in the field of sexual dysfunctions, anti-aging, and fertility. You're welcome. Today, I will look at 20 home remedies for ovarian cysts. What are ovarian cysts? The ovaries are part of the female reproductive system. They're located in the lower abdomen on both sides of the uterus. Women have two ovaries that produce eggs as well as the hormones estrogen and progesterone. Sometimes, a fluid-filled sac called a cyst will develop on one of the ovaries. Many women will develop at least one cyst during their lifetime. Types of ovarian cysts. There are various types of ovarian cysts, such as dermoid cysts and endometrioma cysts. However, functional cysts are the most common type. The two types of functional cysts include follicle and corpus luteum cysts. Follicle cyst. During a woman's menstrual cycle, an egg grows in a sac called a follicle. This sac is located inside the ovaries. In most cases, this follicle or sac breaks open and releases an egg. But if the follicle doesn't break open, the fluid inside the follicle can form a cyst on the ovary. Corpus luteum cysts. Follicle sacs typically dissolve after releasing an egg. But if the sac doesn't dissolve and the opening of the follicle seals, additional fluid can develop inside the sac, and this accumulation of fluid causes a corpus luteum cyst. Other types of ovarian cysts include dermoid cysts, sac-like growths on the ovaries that can contain hair, fat, and other tissue cystadenomas, non-cancerous growths that can develop on the outer surface of the ovaries endometriomas. Tissues that normally grow inside the uterus can develop outside the uterus and attach to the ovaries, resulting in a cyst. Some women develop a condition called polycystic ovary syndrome. This condition means the ovaries contain a large number of small cysts. It can cause the ovaries to enlarge. If left untreated, polycystic ovaries can cause infertility. Symptoms of an ovarian cyst. Oftentimes, ovarian cysts do not cause any symptoms. However, symptoms can appear as the cyst grows. Symptoms may include abdominal bloating or swelling, painful bowel movements, pelvic pain before or during the menstrual cycle, painful intercourse, pain in the lower back or thighs, breast tenderness, nausea and vomiting. Severe symptoms of an ovarian cyst that require immediate medical attention include severe or sharp pelvic pain, fever, faintness or dizziness, rapid breathing. These symptoms can indicate a ruptured cyst or an ovarian torsion. Both complications can have serious consequences if not treated early. Doctors or surgeons may help you remove these types of cysts. This is the only reliable way to remove one completely. On the other hand, you can also try home remedies for your epidermoid cyst. These may help shrink it, reduce its appearance, or alleviate discomfort. A precautionary note. Before discussing home remedies, it's important to go over a few important details. You should never try to remove or pop a cyst at home. This increases chances of infection. Popping also doesn't guarantee a cyst will go away permanently. Even if they're not yet proven to work, trying these remedies poses few risks if used correctly. Remember, if your cyst isn't causing you problems, you don't necessarily always need to remove it. If it bothers you aesthetically, gets infected, causes pain, or grows rapidly in size, then talk with your doctor. Here are 20 ways to healing yourself, and killing this ovarian cyst that seems to love driving you crazy. 1. Hot compress. Simple heat is the most recommended and effective home measure for draining or shrinking cysts. Here's how it works. Heat may reduce the thickness of liquid in the cyst. In the case of liquid-filled epidermoid cysts, this may help fluid drain quicker into the lymphatic system. This system helps maintain fluid balance in the body and plays a role in protection against infection. To use. 1. Heat clean water to a warm or hot temperature, not boiling. 2. Wait for the water to cool to a tolerable, but hot, temperature for skin contact. 3. Dampen a clean cloth with the water and apply to the cyst for 20 to 30 minutes. 4. Repeat a few times each day. 2. Tea tree oil. The essential oil from the tea tree, Melaleuca alternifolia, may help some cysts, albeit in an indirect way. Research shows tea tree oil has antimicrobial activity. This means it kills bacteria, viruses, fungi, and other pathogens. Some cysts are caused by ingrown hairs. These form when hair follicles don't grow properly, leading to infection of a sebaceous gland. This creates a pus pocket that may become a cyst, referred to as a sebaceous cyst. As an antimicrobial, tea tree oil may help kill bacterial infections caused by ingrown hairs. It may decrease the chances of getting a cyst caused by an ingrown hair or reduce its appearance. How to use. 1. Dilute tea tree essential oil in clean, warm, or hot water. The dilution ratio is 2 to 3 drops per 1 ounce of water. 2. Apply the mixture directly to the cyst several times per day with a clean cloth. You can also combine tea tree oil applications with the above hot water compress remedy. Simply add essential oil to the hot water in the proper dilution ratio. Avoid applying undiluted tea tree essential oil directly to the cyst or skin. This may cause discomfort, irritation, or burns. Always dilute this oil before topical use. 3. Apple cider vinegar. Apple cider vinegar is another recommended natural remedy. It may help with costs to a great extent. Apple cider vinegar is shown to be antimicrobial. More specifically, the acetic acids in it are antimicrobial. It will help shrink your ovarian cyst caused by potassium deficiency. How to use. Add 1 tablespoon of apple cider vinegar to a glass of warm water, drink it in the morning and evening. Do it for 6 weeks, and see a tremendous result. It is meant to make the cyst disappear completely. OR. 1. Mix equal parts water with apple cider vinegar. 2. Apply this dilution directly to the cyst several times per day. You can combine apple cider vinegar applications with the hot water compress home remedy. Simply add the apple cider vinegar to the hot water in the proper dilution ratio. Never apply undiluted apple cider vinegar directly to the skin. Acetic acids may cause discomfort, irritation, or burns. 4. Aloe vera. Research shows that aloe vera has confirmed the anti-inflammatory and antimicrobial properties. Both may help with pain and irritation in cysts. Aloe vera may also help reduce the appearance or get rid of certain cysts caused by bacteria or other pathogens. Keep in mind, aloe vera is helpful for discomfort and pain. How to use following label directions. Apply a pure aloe vera gel, cream, or lotion directly to an irritated or painful cyst as often as needed. Only source aloe products from reputable and trustworthy companies. 5 turmeric tablets. These tablets are God sent. Taking 1 to 2 a day for around 3 weeks and the results would be remarkable. When you take these tablets, it will stop bloating and you will feel much less heavy and inflamed. Not only will it help deal with the inflammation from your cyst, but it is also super good for helping repair damaged liver tissues. Use New Chapter Turmeric, and I highly suggest it. 6 peppermint tea. Good quality and organic peppermint tea will help you deal with the pain, discomfort, and swelling. Always have a cup of tea before bed, or after meals. 7 beetroot. Beetroot contains beta-cyanin, a compound in our body that helps boost the liver's ability to get rid of toxins that are lingering in our system. Beetroot also has an alkaline nature which in turn helps balance the acidity in our system. Their combined action helps decrease the symptoms that are caused by ovarian cysts. How to use. Mix 1/2 cup of beetroot juice, or powder with 1 tablespoon each of aloe vera gel and blackstrap molasses. You're supposed to drink this once daily, but if you drink apple cider vinegar every morning, just do this every 2 to 3 days. 8 Himalayan sea salts. I have heard miracles happen when you bathe in Himalayan sea salt. Some women have noticed decreased pain within days, and some say that their symptoms have completely disappeared. How to use. Anytime you do have the time to take a bath, be sure to add Himalayan sea salt. Just make sure it is amazing quality, and that you add it after the bath has been running, not during. 9 Sweet marjoram and clary sage essential oil. Sweet marjoram oil is really good at soothing muscle aches and cramps. It is also a great laxative when applied topically with a base carrier oil and massaged over the bowel and intestines. 10 Clary sage oil. Clary sage oil soothes the nerves and helps you sleep when the pain gets a bit too much to handle. Rub 1 drop, neat, onto my inner ankles, and you will notice a lot less pain almost instantly. Both these oils are amazing, and can also be used in your diffuser to help ease anxiousness, and help promote a calm environment. 11 Cyst blend, geranium and yarrow essential oil blended in a base carrier oil. Geranium oil helps restore equilibrium to your hormones. So basically where there is a hormonal imbalance in your body, cyst, it will help aid your system return to normal. Geranium also balances hormones, relieves stress, reduces depression, minimizes inflammation, improves circulation, benefits the health of your skin. Yarrow oil. Yarrow is also an anti-inflammatory oil, so it is perfect for dealing with cysts. So how to blend? Take 6 drops of each oil, and added it to 150 milliliters of organic massage oil. Massage onto the insides of your ankles, and downwards towards the arch of your foot, around 3 times a day till you notice your symptoms ease up or go away. 12. Maca root powder. Maca root powder is a fertility herb that aids the body produce progesterone and balance the hormones without containing any hormones themselves. Maca root is a plant grown in the Andes. It got some attention in the early 2000s for its potential to help women who are peri- or postmenopausal. It's thought that this herb may help regulate hormone levels. For example, women in one study generally felt they had a better quality of life after taking it. Their discomfort lessened, as well as symptoms like hot flashes, night sweats, heart palpitations, and feelings of depression. Add maca to your oats, smoothies, and treats. It has a pretty bland taste, so you can add literally anything and hardly notice it is there. I suggest this superfood to everyone. 13. Take an Epsom salt bath to help relax your muscles and ease cramping. The same idea applies to taking a hot bath. The heat can ease pain from cysts or cramps. Adding Epsom salts, magnesium sulfate, to your bath can take this relief to the next level. Epsom salts have been used for years to ease aching muscles and other pains. You can find packages of Epsom salts at your pharmacy. Simply draw a bath and add 2 cups of Epsom salts. Let it dissolve fully before soaking in the bath for about 20 minutes. 14. Snack on almonds, which are high in magnesium. Almonds boast high levels of magnesium, which may help with discomfort. Raw almonds contain around 270 milligrams per 100 gram serving. You'll find this ingredient on many "what to eat during your period" lists for this reason. And in more formal studies, supplementing your diet with magnesium has been shown to help with chronic pain. Most people can eat almonds with no interactions. They make a good snack to eat plain or taste great when sprinkled over a salad. However, if you're allergic to tree nuts, you'll want to skip this suggestion. 15. Take dong quai supplements to help ease cramps. You may have heard that the root dong quai can help with menstrual cramping and pain. This ancient Chinese medicine is often found in supplements or incorporated into teas. You shouldn't take dong quai if you are pregnant or breastfeeding, have a blood clotting disorder, take blood thinners. Supplements aren't regulated by the United States Food and Drug Administration, FDA, so you should only purchase them from reputable manufacturers. Follow the dosage directions on the label. 16. Drink chamomile tea to help you relax and ease anxiety. Cozying up with a mug of warm chamomile tea is another option. Chamomile is an herb that's been used since ancient times. It has anti-inflammatory properties to help with cramping and may help reduce anxiety to boot. Not only that, but chamomile may also allow you to get a better night's rest. The best part? It's something you can easily find at your local grocery store or online. To steep store-bought tea, simply boil water and place your tea bag in a mug for a few minutes. Many teas will have instructions on the packaging. You may also make fresh tea using chamomile flowers. For one serving, you'll need 3 to 4 tablespoons of flowers, a sprig of mint, a cup of boiling water. Combine your ingredients in a mug and after 5 minutes, strain to enjoy. 17. Drink ginger tea to help reduce inflammation and relieve pain. Ginger tea is yet another herbal option for the natural relief of pain and cramping. It also has both antioxidant and anticarcinogenic properties. In one study, ginger stopped the growth of ovarian cancer cells, leading researchers to conclude that dietary intake of ginger may treat and prevent ovarian cancer. Like chamomile tea, you can find ginger teas on the shelves at a grocery store or online. All you have to do is steep a bag in boiling water for a few minutes and enjoy. If you don't like the taste, consider adding a squeeze of lemon. To make fresh ginger tea at home. 1. Peel and slice a 2-inch piece of ginger. 2. Boil ginger in 2 cups of water for 10 minutes. 3. Then, remove from heat and add flavorings like lime juice and honey to taste. 18. Adjust your diet. What you eat may affect cyst development. For example, some women go on to develop polycystic ovarian syndrome (PCOS). This condition causes issues like irregular periods or amenorrhea as a result of multiple cysts on the ovaries. About 50% of women with PCOS are overweight or obese. There may be a link between insulin resistance, which makes it hard to lose weight, and polycystic ovarian syndrome (PCOS). As a result, you may want to avoid foods that contribute to insulin resistance. These include refined carbohydrates and highly processed foods, like white bread, white potatoes, anything made with white flours, pastries, desserts, muffins, and other sugary foods. Instead of filling up on processed carbs, try adding foods that help regulate weight and fight insulin resistance. Healthy options include high-fiber foods, including broccoli, greens, almonds, berries, and squash, lean proteins, including fish, tofu, and chicken, anti-inflammatory foods and spices, including tomatoes, turmeric, kale, olive oil, and almonds. If you're having trouble losing weight or managing your diet, ask your doctor for help or for a referral to a dietitian. 19. Consider black cohosh supplements to help regulate menstruation. Certain plants and herbs may help ease a range of menstrual issues. Native Americans and European settlers used black cohosh to support general reproductive health. In modern times, it's often used to help with symptoms associated with menopause, such as hot flashes, night sweats, heart palpitations, sleep issues, irritability. Black cohosh may cause side effects like stomach upset and rash. Black cohosh may interact with medications. You should talk to your doctor before use. 20. Add ground flaxseed to your diet to help balance hormones. Help may be in your pantry already. Flax seeds may lower the body's androgen levels. High levels of androgens in women are often associated with PCOS. In one study, a 31-year-old woman with PCOS supplemented her diet with 30 grams of flax seeds each day. Over 4 months, her androgen levels decreased, as well as her testosterone levels. These findings suggest that the seeds may help to regulate hormone functions. Flax seeds are rich in omega-3 fatty acids and can be part of a healthy diet. You may try sprinkling ground flax seeds atop soup, incorporating them into smoothies, or even supplementing your diet with flaxseed oil. Flaxseed is generally safe to consume daily. Conventional treatment for an ovarian cyst. Your doctor may recommend treatment to shrink or remove the cyst if it doesn't go away on its own or if it grows larger. Laparoscopy. If your cyst is small and results from an imaging test to rule out cancer, your doctor can perform a laparoscopy to surgically remove the cyst. The procedure involves your doctor making a tiny incision near your navel and then inserting a small instrument into your abdomen to remove the cyst. Laparotomy. If you have a large cyst, your doctor can surgically remove the cyst through a large incision in your abdomen. They'll conduct an immediate biopsy, and if they determine that the cyst is cancerous, they may perform a hysterectomy to remove your ovaries and uterus. Ovarian cyst prevention. Ovarian cysts can't be prevented. However, routine gynecologic examinations can detect ovarian cysts early. Benign ovarian cysts don't become cancerous. However, symptoms of ovarian cancer can mimic symptoms of an ovarian cyst. Thus, it's important to visit your doctor and receive a correct diagnosis. Alert your doctor to symptoms that may indicate a problem, such as changes in your menstrual cycle, ongoing pelvic pain, loss of appetite, unexplained weight loss, abdominal fullness. What's the long-term outlook? The outlook for premenopausal women with ovarian cysts is good. Most cysts disappear within a few months. However, recurrent ovarian cysts can occur in premenopausal women and women with hormone imbalances. If left untreated, some cysts can decrease fertility. This is common with endometriomas and polycystic ovary syndrome. To improve fertility, your doctor can remove or shrink the cyst. Functional cysts, cystadenomas, and dermoid cysts do not affect fertility. Alright. Okay guys, I have a question here from an anonymous patient and it says, what are the implications of ovarian cysts on pregnancy? How do they affect someone who is pregnant and someone who is trying to get pregnant? And here is the answer. Some ovarian cysts are associated with decreased fertility while others are not. Endometriomas and cysts from polycystic ovarian syndrome may decrease a woman's ability to get pregnant. However, functional cysts, dermoid cysts, and cystadenomas are not associated with difficulty in getting pregnant unless they are large. If your physician discovers an ovarian cyst while you are pregnant, the treatment may depend on the type or size of the cyst. Most cysts are benign and do not require surgical intervention. However, you may need surgery if the cyst is suspicious for cancer or if the cyst ruptures or twists, known as torsion, or is too large. Alright. That's it guys. I want to remind you very quickly that all the stuff we're saying here isn't really drugs, they're for information purposes, and it's best to check with your doctor before you go ahead and use any of these items. Often don't forget to subscribe so that you will know when we have new videos, and then toggle on your alerts so that when new videos are loaded you will be automatically informed. That you can often share these videos with people who have or are going through these challenges, and let them know. Alright. Thanks so much for watching. Have a good day. Remember, make your food your medicine and your medicine your food.